are at the Galveston docks, and this is where most of the shrimpers in the Southeast Texas region are going to dock whenever they have shrimp. And the shrimpers typically go out for 30 days, 30 to 45 days at a time. And then when they come back, they unload their shrimp here. Some of them live on the boat, some of them live on the docks or in cars if they aren't at sea.
Chúc mừng năm mới! Happy New Year!
Today we have our Lunar New Year celebration, so we do this once a year, or it's called Tet for the Vietnamese group that we work with. And we have traditional dishes and getting to serve people food that they might not be able to get otherwise. And then we also have different groups coming out here that we would normally have. So the Docside Clinic, different toiletries and first aid kits that people can grab. They can grab not only a warm dish for today, but they can also get some canned food to help them throughout the month.
I would say there's two types of research typically. Broad scope is qualitative, which is where you connect with people, you get their personal stories, and there's quantitative, which I'm a qualitative research girl. I love connecting with people, and so this was absolutely like my field of work, is like being able to connect with people, talk to them, and help them find what their needs are. I think this is a wonderful program.
And so when we think about environmental health, when we think about occupational health, we're wanting to highlight that within our community. Like, who are the communities who are putting food on our tables, who are making this happen? And then how do we give back to those communities and make sure they have food on their tables as well? I would say what's great about UT Health Houston is you can choose your own adventure. So if you want to come out to a clinic that's held outdoors at a dock, you can do that. If you are wanting to be in more traditional settings or maybe more traditional environmental settings or wastewater monitoring, you have that opportunity. There's so many different options and choices for people to get involved in both traditional public health, but also in more community-based public health as well.